I think we are live. Yeah. Okay. Cool. Hi. Good evening, all. Today is day 3 of our daily discussion, NEET PG, and we have 31 days more to go to NEET PG. So, welcome to the my YouTube channel. I'm Dr. Raman Polu, based in UAE Abu Dhabi, and I'm founder of Medaffin ecosystem. And this is our Telegram channel. In our Telegram channel, we daily put around 20 MCQs leading up to August 30, and we will be posting mostly image-based, video-based questions and long-form questions, so that you will be well versed. And most of these questions are from previous year questions, so that it will be kind of a revision while you still study on your own. So how we do it is simple. Every day it starts at 8 a.m. and every 30 minutes we will be posting one question in our Telegram channel. Exactly at 5:30 p.m. we will post the last question, and exactly at 7 p.m. we will stop. Like, we will not allow answering the poll, so you have time till 7 p.m. You can answer the 20 questions at around, like, from last question, that is 5:30 p.m. to 7 p.m. So to do 20 questions, I don't think it will take hardly around 25 to 30 minutes. So at the end of the day, you can just sit at 5:30 or 6 o'clock, just scroll and give all answers. And 8 o'clock exactly, we will do the discussion of all the questions which were posted on that day. Okay, so now if we see, this is our Telegram channel. Please scan so that we can, uh, we will be more encouraged actually. So what I will do is I'll put the link in the chat, so that if you are here, you can just click on it and be part of our Telegram channel. Okay. The other rules we follow are, we don't do any advertisement, we don't do any selling, we will not ask you to buy any of our products. This is done this solely to serve NEET PG aspirants who are appearing for August 30. So we decided not to do any selling until August 30. Okay, we will not do any advertisement. We do have products, but we will not do any advertisement. So it's purely MCQs. You can do it and you can be part of this discussion. Yeah, so hopefully some people are watching this. If somebody is watching, please give it a thumbs up, say hi. And if you are watching right now and you are not part of the Telegram channel, I will request you to join our Telegram channel. Just scan the link, or click on the link or scan this QR code. And without wasting further time, let's start, because it's already 4 minutes past 8 p.m. Okay, this is a first question. Okay, tumor lysis syndrome is an oncological emergency presenting with all of the following below, except. So please always be attentive to the question, read the question, understand the question, wait for 1 second, then answer. So the question is, tumor lysis syndrome is an oncological emergency presenting with all of the below except. So this except is the key, right? So the options are hypophosphatemia, hypocalcemia, hyperuricemia, and hyperkalemia. Okay, we all know what is tumor lysis syndrome. Tumor lysis syndrome is nothing but when the tumor cell get damaged, either because of therapy or maybe because of various reasons. They will release various electrolytes or various structures from their cell wall into the bloodstream. Okay, and there is a mnemonic for it. Okay, and everybody knows about it. And anyway, I'll tell. It's called puke calcium. Okay, puking calcium means you are eliminating the calcium. So obviously, When the calcium is eliminated in the body, it means it causes hypocalcemia. So hypocalcemia cannot be answer. And P stands for phosphorus or phosphate. So phosphate will be increased, and U stands for uric acid. So uric acid will be increased, and K stands for potassium. So potassium will be increased. PUKE. So it means potassium, uric acid, and phosphate will be increased, and E eliminated is the calcium. So the answer is obviously uh, the first option, which is hypophosphatemia, rather than it is hyperphosphatemia. Okay, so it's a simple question. Coming to next question, this is an image based question. Okay, this is an ultrasound image and this is a color Doppler. So the question is, ultrasonography of the report of an old woman with postmenopausal bleeding revealed a mass with a feeding vessel. So this is the catch point as shown in the image below. What is the most likely diagnosis? Okay, so uh, we have like five votes for this, which is given as endometrial polyp. And if anybody is there in the chat, if they can answer this question by the time it reaches you, I mean, we go to other question, I'll be very happy. So what's your answer for this? Is it A, B, C, D? Okay, so just type in the chat so that I'll be happy, so that somebody is seeing my videos. Okay, let's go to the options. Leiomyosarcoma. Leiomyosarcoma is actually carcinoma of smooth muscles, which are actually the linings of abdominal visceral walls, right? When stomach, intestine, and all. The second option is endometrial polyp. Endometrial polyp is actually polyp arising from endometrium, obviously of uterus, and it is most commonly found in older age, postmenopausal, and it is one of the common causes for postmenopausal bleeding. Okay. Number three is endometrial carcinoma. Obviously, the name suggests it is a carcinoma of endometrium. It also has uh, the other things like bleeding, and it also has postmenopausal discharge. Not postmenopausal. Whenever there is endometrial carcinoma, there will be intermittent bleeding, intermittent like a regular um, vaginal discharge, bloody vaginal discharge, and the associate signs will be most probably like patient can be cachectic. Maybe they are reducing weight. They also have heaviness or pain. Number four is fibroid uterus. Fibroid uterus is actually the benign tumor of uterus. Okay, so if you go by the four options, feeding vessel, this is the catch, right? Feeding vessel is seen in endometrial polyps. Fibroid uterus is mostly it will also cause delayed menstruations or painful menstruations, but endometrial carcinoma is most it will cause, yeah, endometrial carcinoma like causes like sorry, it also has other issues, like like I said, there will be a weight loss, and there will also be like heaviness, pain, and discharge. So this is a case of postmenopausal woman. Mostly postmenopausal woman, it is most probably the endometrial polyp, painless bleeding with a feeding vessel, which is found on color Doppler in in uterus. So that's a catch for everyone. Okay. So five people has given answer, and everyone has given the right answer in the group. So yeah, this is the second question for the day. So please, if you are following or if you are just seeing, please be considerate about joining our Telegram channel. We will not be, we are building the, we are aiming to build the biggest healthcare network around the world, and it is backed by doctors, physicians, and other healthcare professionals who are from different countries. So I hope we started this initiative for NEET PG. I hope this will be an entry point for you guys into Medaffin ecosystem. Yes. Coming to the next question, it's an image-based question. Which of the following correctly describes the status of patient depicted in image below? Okay. So here the options are here, right? Heart rate absent, breathing present, right? Both heart rate and breathing present. Breathing absent and heart rate present. Both heart rate and breathing absent. Okay. If anybody is there in chat, can I get a hi, or can I get at least the answer for this question, or any reaction, please? Thank you. If somebody is there in the online, please give a thumbs up or hi or something like that. Okay, let's discuss the options first. Heart rate is absent, breathing present. So obviously the patient um, will not be kept in this position, right? If you find a patient with heart rate option like absent, obviously you will check and start CPR immediately, right? If even if the breathing is present. The second option is both heart rate and breathing present. We'll come to the option next. Breathing absent and heart rate present. Obviously, even if the breathing is absent, we will not always keep the patient on the sideways. Obviously, we will keep this patient in supine position with chin up position, so that, and we will be giving either non-invasive ventilations, so that the breathing will be maintained, right? And the third one is both heart rate and breathing are absent. Obviously, we'll start CPR. The option, correct option is both heart rate and breathing are present. Okay, and this is actually recovery position. Okay, recovery position is some position where like you find a patient who is unconscious, so you will try to roll him on his sideways with uh, uh, the side on which his leg he is lying on the leg, that leg will be kept straight, and the opposite leg will be bent at the knee and hip region, and make sure that he will stay in the same position by placing his hands in proper position, right? This way what it does, it removes the possibility of tongue blocking his airway. Okay, and this is most commonly done in ROSC patient. Okay, where return of spontaneous cardiac activity in patient who has underwent CPR and his heart rate and respiratory rate has recovered, we'll keep the patient in left lateral position to make sure that he will not obstruct himself with the tongue falling back. And if you might have seen, you also might have done the same thing for the people who are in seizures. When you see them like and you don't have any means, so you try to keep them in the sideways position, so it's actually recovery position. Coming to the next question, another image based question. Okay, which of the following helminthic infections that commonly transmitted by soil is characterized by egg in the stool as shown in the image below? Okay, so the options are trichuris tracheura, ankylostoma duodenale, Nicator americanus, and Ascaris lumbricoides. Okay, so these are the four options, and the telltale sign is it is transmitted by the soil. Okay, these uh, helminthic infections are transmitted by the soil, and if you see the image, you can see it appears like a lemon, which is not regular lemon, which is kind of hybrid lemon, what we get in India, like slightly yellow color, elongated, right? Or it can be like similar to a barrel shape, right? Barrel which we usually found that stores various liquids or wine and all those stuff, right? So that's barrel shape, and you can see there is a translucent areas at the both end. These are mucus plugs. Okay, so the mucus plugs and barrel shaped helminthic eggs which are transmitted by soil are actually trichuris trichiura. Okay, so four NEET aspirants has given their answers, and yeah, obviously the answer is correct. Coming to, I'm getting messages, but it's fine, no problem. Let's go to the other question. Okay, coming to the next question. If anybody is there in the chat or anybody seeing online, just say hi. Please join our Telegram channel. I'll be very happy to share more questions, and going forward we are planning to share somewhere around 1000 to 1500 high yield previous year questions, so that even if you do 20 questions, spend 30-40 minutes a day, I guess you will be very good to go, and your score will be more, right? Okay, that's one thing. Second thing is, we also, like I said, the channel is completely devoid of any advertisements. We don't sell any products, and this is done so that you will not be disturbed. Okay, cool. So the question is, 18-year-old male patient presented with a history of lower backache and early morning stiffness for 2 years. He also gave a history of bilateral heel pain since 6 months. Which of the following is most likely diagnosis? Okay. Coming to the options, so we have four options: ankylosing spondylitis, tuberculosis of spine, disc prolapse, mechanical pain. Okay, so let's go with the answers given by the candidates. So four votes has been done for this particular question, and four has given the answer ankylosing spondylitis. So reason being, like, fairly this is an young patient, and other symptoms include, backache, early morning stiffness is also there, and bilateral heel pain is also there. So there is point tenderness around the Achilles tendon attachment at the heel, and if you test this patient, most probably he'll be HLA-B27 positive also. Okay, so coming to the next option, tuberculosis spine, it is also called Pott's disease, and it is to infection which may progress very slowly, and it may be associated with temperatures. um, Patient may lose weight. Patient will also have elevated ESR and all those findings which are typical of tuberculosis. And if it is not treated properly, patient may land up even in paraplegia, or uh, it can affect the spinal cord also. Okay, disc prolapse, usually disc prolapse, the pain will be very severe, and it is not associated with early morning stiffness, and he will not have this bilateral heel pain. Obviously, if there is a disc prolapse and if there is a nerve compression, there will be radiation of pain, depending on the which side the nerve compression is there. And also, if he has any other if the disc prolapse is very severe, he may also experience tingling, paresthesias in limbs, or he may also experience bladder and bowel symptoms also. Okay, mechanical pain is something which is like related to it's more of muscular pain, and it can be because of various reasons. It can be an osteoporosis can cause mechanical pain. Okay, coming to the next question. So if there is somebody in the chat or online, please give a thumbs up. I'll be very happy. So yeah, good. Let's see. Good. Thank you. Let me just open it. Cool. Okay. So before going to the question, I humbly request, please follow our channel, be part of our Telegram channel. Okay, coming to the question. The pregnant woman, a pregnant woman post cesarean section was put on magnesium sulfate infusion for preeclampsia. She is known case of type 1 diabetic. She developed delirium and appears drowsy with a respiratory rate of 10 per minute. Random blood glucose level is around 240 mg per dl. She has oliguria and bilaterally absent knee reflex. What is the cause of her condition? Obviously, her glucose levels are very high. She is a no diabetic. Her heart heart rate, this will can be a distraction, right? Heart rate, she is delirious. Her respiratory rate is low, and she appears drowsy. And absent knee reflexes are the telltale sign for this particular presentation. Obviously, she is a post-cesarean section patient on magnesium sulfate, and we all know that magnesium sulfate has low threshold for getting toxic in the body. So always we need to monitor their we need to give dose in a proper way, right, rather than go touching the threshold and making problematic for patients. We have to always keep, and it is actually given as treatment of choice for patients with eclampsia or a prophylaxis for preeclampsia. Here the patient is a preeclamptic patient, underwent cesarean section. Obviously she might be going into eclamptic phase, so they wanted to prevent that, and she might have received a large dose of magnesium sulfate, which resulted in this uh, situation. Okay, so obviously diabetes insipidus is not the case because she is already type 1 diabetics. Diabetic ketoacidosis, there is no mention of pH or shallow breaths. It's a reduced breath, not the shallow breath. And obviously eclampsia can be ruled out because it's like she was taken into cesarean section at the time when she was pre-eclamptic. Okay, coming to the next question. So we are already around 22 minutes. Okay, which of the following mechanisms is seen in baroreceptors? The four options are feed forward, negative feedback, positive feedback, adaptive control regulation. Okay, so three aspirants has given their answers as negative feedback. Two students has given their answers as positive feedback. Even though this question is very simple, obviously if you see the mechanism of baroreceptor is very simple. Like whenever there is a change in blood pressure or the volume, what happens obviously is the baroreceptors in your baroreceptors, either they will get stretched or they will get normal, or they lose the stretch. Okay, resulting in, if they are stretched they are stretched too large, if it is stretched more, they will activate the parasympathetic and decrease the sympathetic, resulting in decreased heart rate, decreased blood pressure. So if they are stimulated more, they will stimulate parasympathetic more, resulting in decrease in heart rate and decrease in pressure. If the blood pressure or volume is decreased, they will obviously the stretching will completely come down, which results in activation of sympathetic and suppression of parasympathetic, and sympathetic drive will obviously increase the blood pressure and heart rate, right? So obviously it's going opposite. When this is activated, blood pressure is coming down. So it's obviously a negative feedback rather than positive feedback. Positive feedback is more like when you have more levels, obviously that results in production of more. Let's say TSH is more, you will have more thyroxine. Okay, but when thyroxine is heavy, it works on pituitary, and uh, it reduces the production of TSH. That is negative feedback. Okay, coming to the next question. Okay, let's go to the next question. Yeah, this is an image based question. If you see the image, uh, I see, like, you can also see the name of the question. Okay, above is the spirometry reading of a 35-year-old male, and there is an arrow mark black. This is the arrow mark, the graph. Which of the following does this marked area, not market area, sorry, it's market area represent? Okay, so if you see, this is a normal respiration, and he inhaled like extraordinarily. He tried his maximum, then he exhaled, and he tried to exhale as much as he can, and he returned to normal. Okay, so this is actually, tidal volume, right? uh, and anything below tidal volume to zero is functional residual capacity, right? And closing volume is, I mean, the option is obviously the right answer is functional reserve capacity. So it's pretty straightforward question. So obviously, uh, these kind of questions are really easy scoring, so you should not miss these kind of questions. So coming to the next question, again this is another image based question. The nerve injured at the arrow marked region is, if you see the arrow is marked at this elbow region, right? And it is more medially. Okay, obviously we all know the nerve which passes through that part of elbow, it is ulnar nerve. And even before we studied medicine, when we are younger, we used to play with our friends that do you want to get experience of current shock, right? So we used to just press that part at the middle part of the elbow. We didn't know that was a nerve then, back then. So the person, your friend, used to feel jitteriness in his hand, so we used to call it as current shock. Okay, and obviously ulnar nerve is the answer. Coming to the next question is also image based question. So many image based questions we are keeping, just so that you will be acclimatized to the new NEET PG. We are expecting that almost 8 to 10 image based questions per section, maybe two or one video based question per section. So we can expect somewhere around like 20 to 25% of questions will be image based and video based. Okay, so this is the X-ray. Just observe the X-ray. A 35-year-old male presented with severe pain abdomen. Okay. Thanks, Aparna. Thank you very much. What is the likely diagnosis? Cool. Okay. The likely diagnosis is, if you see the chest X-ray, you see uh, a small shadow just below the diaphragm. Okay, so it shows that there is an area under diaphragm. So if you go to the options, we have perforation peritonitis, obstruction acute pancreatitis, and Borheim syndrome. Okay, if you go to the options, which of these options will produce gas under diaphragm? Obviously it's perforation peritonitis, and obviously the patient might be a case of duodenal ulcers, or any kind of peptic ulcer that might have resulted in perforation. And in perforated like patients with these perforations, abdominal perforations, visceral perforations, obviously on erect abdomen we will see gas under diaphragm. That's a telltale sign. Okay, and the treatment will be obviously laparotomy and explorative laparotomy, and closing the perforation and keeping the patient in ICU for time till he recovers. Okay, coming to the next one more question, which is uh, you know image based question again. Like I said, like we do post around 20 questions. If you see, there will be no advertisement, no nothing, like everything will be like proper. So join the channel. You have 30 days. We'll be posting somewhere around 1,000 questions. Like we are planning to post more. Right now we started with 20. Maybe we will be doing some extra sessions, or we may be handing out important questions which can have probability of coming in 2026 NEET PG. So be part of the channel, get everything for free. Just use the occasion, be part of this channel. So just scan this QR code, or uh, one more time I'll share If you are watching it, you can also just, you know, join by using the link. Okay, and once the session is over, I'll also keep the link in the description and in the first comment also. Thank you. Okay, coming to the question. So we are already around 30 minutes past our time. I'm not past our time, it's like 8:30. Obviously, I'm in Abu Dhabi, so my time is still 7 p.m. I do office in the morning, come back, prepare, and present this. So these efforts are for you guys. Cool. A child with a history of recurrent respiratory infections presented with complaints of pain around the knee and high grade fever. Okay. X-ray shows lytic and sclerotic bone. Okay, this is a telltale sign, right? X-ray shows lytic and sclerotic bone. His peripheral blood smear is shown above. This is a peripheral blood smear. Aspirate from the joint will most likely show. Okay, if you go to the options, we have Staphylococcus aureus. Number two is Escherichia coli and Salmonella and Streptococcus. If you see these blood cells. These are sickle. So it's a sickle cell anemia. The patient is a known case of sickle cell anemia, and patient also has high grade fever and lytic lesion and sclerotic lesions of the bone. If you see, sickle cell anemia is mostly associated with infections again with salmonella, and salmonella is one of the most common cause of osteomyelitis in sickle cell anemia patients, right? So this whole presentation will point towards salmonella, and almost all the students have given the same answer. That's great. I think it's an easy question. Okay, this is easy question obviously. So anatomy, if you see the skull, identify the marked area of the image below. We have five answers. Five has given the same answer, that is styria. Nasion is obviously on the frontal part, and gabella is the smooth area between both eyebrows, and lambda is around the place where the other joints are there, right? Coming to the next question. So this is ECG. I don't know how much you can see the ECG. Let me just zoom out and zoom in. Okay. So a 68-year-old male admitted to ICU for acute exacerbation of COPD develops a sudden onset of palpitations. Okay, so 68-year-old admitted to ICU, acute exacerbation of COPD, develops a sudden onset of palpitations. The following ECG changes are seen. What is the most likely diagnosis? I don't know if you guys can see it, but you can see I'll tell you the findings, right? The heart rate is slightly irregular, and also you can see multiple p waves which are of varying shape and size, right? This arrow marks, if somebody is in the group, obviously they can join. Thanks, two people has joined the group, and thank you very much. It encourages a lot. Yeah. So the size of the p wave is changing, and the heart rate is also changing. So obviously this is something to be associated with atrial rhythm. And so is it ventricular tachycardia? No, it's not ventricular tachycardia. Obviously ventricular tachycardia will have wide complex. And if it is atrial fibrillation, you will not see the p waves, and the heart rate will be irregularly irregular, right? Here also the heart rate is slightly irregularly irregular, but still you will not see p waves. And atrial tachycardia, the rhythm will be not irregularly irregular, right? And here the answer is multifocal atrial tachycardia, because uh, when right atria has multiple focus, let's say it has a rhythm is being fired from multiple areas, let's say here or here or here. This rhythm will produce a different p wave, and this rhythm will produce a different p wave, because the amount of time it takes to travel will change the shape of the and the amplitude of the current will change the shape of the P wave. So obviously different type of P waves, different shapes of P waves with heart rates, varied heart rate. The answer is multifocal atrial tachycardia. Okay. So four NEET PG aspirants has given their answers, and three of them are given option as multifocal, and one has given atrial fibrillation. But still, yeah, it's confusing. But please be make sure that you observe the P wave. Okay. Yeah, if somebody is there in the chat, I'll be happy to get some reactions or even yeah, thank you, or even is high or anything like that. Yeah, let me put my thing. Let me just track it. Okay, cool. Okay, now coming to the next question. It's not fourth question. If you see, we are putting a lot of effort in this. We are scheduling the even scheduling the messages. Sometimes if it is not dropping, somebody in the admin is pushing these messages. So and we are also like very conscious about choosing the questions, correct questions also, rather than wasting your time. High quality questions are being chosen, and in coming days the quality of questions will be better and better. Coming to the question, right? A young male patient was given a regional block with 0.25% bupivacaine, okay, for a minor surgical procedure. Shortly after the injection, the patient suddenly became unresponsive and the pulse was not recordable. Which of the following would be the best management for this patient? Okay, unresponsive patient, obviously CPR. So CPR is there in every patient, and the treatment of choice for this particular injection is actually 20% intralipid. Okay, so the answer is CPR with 20% intralipid. Okay, 5 has given the answer, and I feel this is an easy question, so everybody has given correct answer. Okay, coming to the next question. If you see, this is also an image based question. I hope you are seeing the question. Yes. Okay, a 35-year-old man presented with knee pain. The X-ray of this knee joint is given not below, above. Which are what is the probable diagnosis? If you see, the bone above is looking normal, and the bone below, you can see there are translucent areas which are irregular, right? Looks like kind of pockets, lacunar, translucent areas in the tibial. Okay, so if you see the answers, obviously the answers are, the options are chondroblastoma, uh, osteochondroma, osteoclastoma, and fibrous dysplasia. And this is also a very simple, straightforward question. If you read the definitions of each condition, it gives you the answer, right? Osteoclastoma is the answer, and four people has given the answer, and they have given correct answer. Obviously, osteoclastoma will result in the lytic lesions, which give this appearance of um, irregularly shaped lytic lesions in the bone area. Coming to the next question. Yeah, this is the next question. An young male who is shy and prefers social isolation appears to be sorry appears to be a uh, emotionally cold and resides alone. There is no history of hallucinations or delusions. The most likely diagnosis is okay. So paranoid personality disorder, schizoid personality disorder, antisocial personality disorder, and emotionally unstable personality disorder. Okay. Psychiatry, being psychiatry, it's very difficult to understand. Even I felt it is antisocial personality, but it is not antisocial. The correct answer is schizoid personality disorder. Schizoid personality disorders are characteristically, a persistent detachment. The patients will have persistent detachments from social relationships. So they interact very, they you feel like they are very cold to you, right? Yeah, so that kind of restrictions they maintain, and they always have a restricted range of emotional expressions, right? So they usually do all things in solitude, or they are solid solitary organisms, and minimal interest in social interactions, and they also lack desire to have close relationship, okay, including romantic connections or friendships or best friends, something like that, okay. Typically they do not experience paranoia or hallucinations, okay. uh, they are described, I mean, it's not what they say, they are described by other people as very shy, socially withdrawn, or emotionally cold, which aligns with schizoid personality disorder. So like if you guys are going I mean, try to read psychiatry, PSM, and the biochemistry and microbiology more, because these are scoring subject, try subject but scoring subjects. Yes. Coming to the next question. This is an image based question again. A newborn female patient presents with continuous dribbling of urine, and the image shown above shows the pathology from which the patient is suffering. The most likely diagnosis is. So if you see, the bladder is appearing outside, right? What are the options? The options are gastroschisis, bladder extrophy, superior. Let me slightly bring it up. Okay, superior vesical fissure, anterior ectopic anus. So obviously, it's nothing to do with anus. Uh, the other things are like dribbling of urine, continuous dribbling of urine. So it is something to do with the bladder. So obviously, it's bladder extrophy. Yeah. So four people has given the answer correctly. Okay. Next is also an image based question. So a patient presented with patch on the neck region. Okay. And in the mandible associated with presence of leukotrichia, I mean white hair in this area. The most probable diagnosis will be, okay. We have nevus depigmentus. Four people has given answer. The second option is pebaldism. Number three is focal vitiligo, and four is segmental vitiligo. Okay, if you see, the correct answer is segmental vitiligo, and four NEET PG aspirants has given the same answer, segmental. It affects the segment, okay, and we all know that the whole body has various segments, and if it is affecting only certain parts of body, with all the things which in that particular area has depigmentation, including the hair, it is actually segmental vitiligo. Okay, so given thumbs up if somebody is watching this, I'll be very happy. Okay, yeah. So before going to it, this is our Telegram channel. Please scan it, or I will put the link in. The link is there already in the subscription. And this is our last button question. Okay, so I guess like we have done a good job today. We have almost like till now we completed 35 minutes, and we have done a good job. So 20-minute questions, around 35 to 40 minutes is our goal. Okay. What is the probable reason for quadriparesis developed by a 60-year-old patient after being treated with significant amount of uh, hypertonic fluids for 24 hours? Okay. The same thing, like it is a very straightforward question, and four people has given their answers, and everybody has given, sorry, my alarm. So everybody has given the same answer, that is central pontine myelinosis. Okay. The scenario describes a 60-year old developing quadriparesis after being treated with hypotonic. Okay. This results in a condition obviously we all know, which is giving these symptoms. It's called central pontine myelinosis, and it is because of rapid correction of hyponatremia. So if you have hyponatremia patients, you cannot push sodium chloride 3%, like that, right? You need to make sure that you give it in a proper, and obviously in older age patients with some symptoms or some other disease conditions, hyponatremia is one of the most cause. 60-year-old is not that old, but still, like a very old age, electrolyte imbalance is one of the major things. They will be affected if they ever become sick or ill, right? And during these conditions, we always treat these patients, correct the electrolyte imbalance with caution. Okay, so obviously the correct answer is central point. And brainstem injury cannot be a thing, and brain infarct usually will not cause like a quadriparesis, right? It mostly causes either one side, paralysis or paraplegia, right? Rare causes of hypernatremia is also a wrong uh, answer. Okay, now coming to the video based question. Okay, we have kept only one video based question, and if you guys want, and if you join more, right, we are planning to introduce more videos. We are collecting videos like probable video based questions that may be asked in NEET PG. So we are collecting somewhere around 150 200 videos, and planning to develop a module so that anybody who is part of our platform will get that module for free. So what this module does is, you will be given an access to the module. You will just go, you will have your login and log out, right? Then start answering the questions. At the end of each question, you will get the answer, right? So that you can have a practice of around 180 to 200 questions for free. So this is also one thing which we are trying to do. And obviously this whole platform is built to make sure that we have this community formation. Okay, and if somebody is willing to teach in our platform, they are very welcome, and we do have almost 15 to 20 experts as a part of this platform. And even in future, if we do, we will definitely conduct courses, but if we are doing it, we always have this mentality of keeping the cost very low. Okay, so okay, without discussing all these things, let's go to the question. A 3-year-old boy is brought to ER with sudden onset choking, cough, and unilateral wheezing while eating mixed nuts. It's a telltale sign, obviously, 3-year-old eating nuts. A rigid bronchoscopy shows the camera advancing past carina. It is going after the carina, right? Into one of the main bronchus. Based on the pulmonary anatomy, into which specific airway is the peanut most likely to be lodged? This is also a very straightforward question. If you see anatomy, and most of the times the children in this age do suffer this kind of choking effect. If it is choked here, obviously the treatment is Helmicks manner. Just push just above the umbilicus, just below the diaphragm, so that he will cough out. But if that is very small and it goes below the into the trachea, right, the first place it will go, or the 99% it will go, is into the right main bronchus. The reason being, the anatomy is like that. The trachea will be like this, and it is more towards right. The left is slightly more angulated, resulting in a smooth flow of any foreign body because of gravity or other reasons into that bronchus. So obviously the answer, I mean, the options are right main stem bronchus, left main stem bronchus, and superior lobar bronchus, left inferior lobar bronchus, right superior lobar bronchus, left. Four people has given the same answer, and I guess like that's a very good thing, and because it's also a simple question, even though it's a video based question, it's a simple question. So yeah, we have completed 20 questions, and we also completed 40 minutes. Yeah, it is a great day. Like I said, same format we will do tomorrow also. So if you are part of this channel, Please answer your questions whenever you have time. If you don't have time, just wait until 5:30 p.m. Answer like all the questions at a go. Like it takes maximum of 20 minutes. Then if you are confident, you can study yourself. If you want to listen, like if you want to have that 40 minutes, you can just come to our channel, YouTube channel. When we post the live, we'll post a link also in the group, and you can just follow on, and you can just listen to my conversation when you are eating, when you are going or walking or something like that, just to relax, right? So that some or other points maybe you might not have read it, some of these things might go directly into your subconscious memory. Okay, and it's kind of repetition, right? So you read it, I'm just repeating all this stuff so that it'll register more. Okay, so same thing, 8 a.m. we'll start again in the morning. Every 30 minutes we'll keep question. Last question will be 5:30. You will be given option to choose your answers till 7 p.m. and 8 p.m. we'll start the live. Okay, I will also do the same thing. I'll go to my work, complete all the work related things, come back, prepare, and do this presentation. So please subscribe to my channel if that is this exercise is helping you, and please join our Telegram channel. So let's make this the biggest healthcare network in the world. Okay, and I guess students have more power than anyone, so I believe in that. So this is our QR code for Telegram channel, and if you wanna, like, I will put the link again in the description and the first comment. Okay, yes, thank you all. Happy reading. Don't get stressed. Do repetitions. Relax yourself. Keep on reading. Nothing is impossible. Okay, thank you.